Welcome everybody to our 9th webinar. This is Judy Mark from Disability Voices United. We're going to wait and let everybody join and get started in just a moment. Welcome everybody. We're glad to see you. We'll be getting started soon. You can see in the chat that we have simultaneous interpretation for this webinar, and there is a specific phone number for you to call to receive that interpretation. So I'm going to ask our wonderful interpreter, Lorna Silva, to please announce in Spanish how people can access that. Go ahead, Lorna.
A todas las personas que hablan español, si quieren escuchar esta presentación en Zoom en español, tienen que llamar al número de la línea de conferencia 515-604-9835, de nuevo 515-604-9835, y el código de acceso es 245-384, de nuevo el código de acceso es 245-384 y después presionan la tecla de número. Muchas gracias. Thank you.
Thank you. Okay, we are going to get started very, very soon. Just let everybody join. And want to welcome everybody to our 9th webinar. For those of you who've never been part of our webinars before, my name is Judy Mark. I am the president of Disability Voices United, which is a statewide advocacy organization directed by and for people with developmental disabilities and their family members. We have been working on working with the disability community on being prepared for this COVID crisis since mid-March and have been doing weekly webinars on them. And so I really can't believe this is our 9th already. Time flies when you're not having very much fun, but we are so happy and pleased that all of you are here. Just a little bit of ground rules and housekeeping for everybody. This is a webinar, it's not a meeting, so the only people who are going to be able to speak are those who are on the screen. These are our presenters today. For those of you who do have questions, you can ask them through the Q&A, which you will find at the bottom of your screen with two little word bubbles, voice bubbles. If you put anything in the chat, we will try to respond to it, but it is, we'd rather you not put questions for the presenters in the chat because the chat is constantly moving. If you are having any problems hearing or any problems with accessing this webinar, please put that in the chat, and our wonderful program assistant, Ed Herzl, will be responding to you and ensuring that you are any questions you may have are answered as far as the operations of this particular webinar. So with that, I would like to welcome our amazing panelists that we have today. I just want to start by saying a few things because I know all of you are here to hear about about the budget. And when we created the headline, the title of this webinar, we talked about drastic cuts, because we knew that the state budget would have drastic cuts, and in fact, it does. Very, very dramatic and drastic cuts. We anticipated that those drastic cuts would impact many of the services and supports that we need in a way that could be life-threatening. I can tell you that overall, we have come away from this with far less damage than could have been done. And we are, while we wish there were no cuts at all and that all the new exciting programs that we were hoping we were going through had gone through, knowing that we're facing an unprecedented crisis in the state of California, we feel that the governor has actually done a pretty good job of protecting us in many ways. That's not to say that there aren't some very significant cuts that are very problematic, but you know, on the whole, we at least at Disability Voices United are we are relieved that it could have been much, much worse. And we think there are ways, and we'll be presenting you with ways of making it actually not even as bad as it could be. So with that sort of changing of the tone, so that those of you who are in the same panic that we've been in for the last week can take a deep breath and now listen to really what is in there. And I'd now like to present our first person, the first presenter. By the way, I know that we said that somebody from the Department of Developmental Services had been invited. We were really hoping that they could come on, but unfortunately they haven't been able to. They have their hands very full right now with a lot going on, and because not only are they working on the budget, but they're still also supporting our community in responding to the coronavirus. So our first presenter is really one of our favorite people, and actually really helped to make Disability Voices United get off the ground. And we love her so much. She's recently retired as Executive Director of Disability Rights California, and is also now a member of the Governor's Task Force on Business and Jobs Recovery, which is that very prestigious committee. And we are so happy to have one of our greatest allies on that group to bring our voice to it. So I want to thank Catherine Blakemore for coming on, and I want to also let everybody know that she has a meeting of that task force and other groups. She has a lot going on this afternoon, so we're so thrilled she could be part of our webinar, but she'll only be here for about a half an hour. So thank you, Catherine.
Absolutely. It is, I just always very exciting to be with all of you and to really talk a little bit about the budget. And what I think is more important is some very specific ideas I have about what all of you can do to make sure that the budget doesn't adversely impact the communities that we all care so very much about. So with that, I'm going to pretend like I'm DDS for 2 or 3 minutes and talk a little bit about the budget. There are lots of people on this call that also know a lot about the budget, so feel free to weigh in if you have other things that you want to say. So I think the way I would frame the budget is there is a very large deficit in the overall state budget, $54 billion, an amount of money I will never see in my lifetime, or any of you most likely. What the governor is trying to do is be strategic about how to address that deficit. And the deficit really is sort of a loss of revenue at the same time knowing that there are people who have been laid off. There are people who need services that they didn't need a few months ago. And those services also have to be factored in. So unemployment, for example. So it's how do we in California address that kind of deficit? The governor also has laid out a path by which we're going to use reserves. We're going to identify some ways that as a DD system and other systems, we can save some money or generate some new money. And most importantly, the budget is really predicated on that Congress is going to pass a next portion of a federal relief package. And if they do that, then many of the potential cuts that are identified in this budget will not come to be. And that's where all of us have a really important role in talking not only to our elected representatives from California, members of Congress, as well as our 2 senators, but also letting family members know in other states that have equally important senators and congressional representatives that they should weigh in about the importance of additional funding. The governor, along with a number of other state governors, has requested $1 trillion in funding that would go directly to states to help offset numbers of the cuts that are proposed here. So with that, I'm going to just start by sort of saying what's happening in the DD space, and then turn to a couple of other other systems. So within the developmental disabilities system, there were a number of proposals that many of us thought were forward-looking, and those are simply going to be paused. And I think the governor's clear, like, it's not like they were bad ideas, they were good ideas, but we shouldn't bring new programs to be in a time when we're trying to preserve the programs that we already have. So an example of that was the governor had proposed a performance incentive program for about $8 million, as I recall, that would have required measuring outcomes and seeing if we could improve the service delivery system for people with IDD. That's not gonna move forward. There were some proposals for enhanced case management for younger children to help make sure that they got the services. Those aren't going to move forward. There are also identified cuts that will in fact go into place if we do not get the full amount of the federal bailout, or the $1 trillion as Governor Newsom refers to it. There'll be a reduction in regional center operations. There will be a restructuring of the parent cost sharing program, which is an amount of money that parents pay for services if they're above 400% of the poverty level, unless they're on what we call Medi-Cal in California or Medicaid. And we're really lucky to have Allison Morantz here, who's one of the experts in identifying how best to get eligible for Medicaid so that that would not affect people. And then there's a series of proposed rate reductions. So providers got a rate increase last year. There's a series of proposals to reduce those rates if we don't get the additional funding, and there's an imposition of the uniform holiday schedule. So those are some highlights of what's happening in the developmental disability space. I think there's equally concerns about things that impact people with intellectual and developmental disabilities in other systems. Because what we know is while we get a lot of support from regional centers, people also rely on other programs to get their support. So one of the proposals, if there isn't a federal backfill, is a reduction of IHSS. This was a case that was litigated in prior years, and the case was settled for a temporary, so we thought a 7% reduction in the number of hours that people had. Those hours were temporarily restored. That restoration will go away if there isn't the additional federal dollars. There's numbers of cuts to the Medicaid program. Some are new initiatives that just will not happen, which was expanding access to Medi-Cal for people who were up to 138% of the federal poverty level and were either aged or disabled. There were proposals that would have extended Medicaid to adult immigrants. Those are new proposals and aren't moving forward. There's other things within the Medicaid space, such as access to dental care for adults, that will be rolled back if we don't get the federal bailout. There's also a proposal around SSI. So right now, Californians on SSI actually haven't gotten an increase because we've always just kind of assumed that the federal increase was enough to keep things where the government thought they should be. But in this case, if there's not an increase at the federal level, which might well be tied to this ongoing new federal money, then the SSI benefit would actually be rolled back, which would have a very significant impact on people with intellectual and developmental disabilities, as well as other consumers. So that's kind of a very quick snapshot of the bad news, but I want to return to what I said at the beginning, which is all of us have a part in this, and that is two pieces. Get to your federal legislators, get to family members that live in other states, and tell Congress to pass the additional federal stimulus that will provide additional funding to California and help protect people's health and safety and economic security. And then also let your state legislators know about the impact that some of these proposed cuts will have on people with intellectual and developmental disabilities, so that as they're balancing what cuts to make, for example, if we don't get all of the federal stimulus that we're asking for, that people with disabilities can be protected in the federal budget. So that's your sort of marching orders of get engaged. It really does matter right now. And, you know, Judy is one of the best community organizers I know, and I'm sure that Aaron Crothers will be mobilizing the state council network about the importance of this. So lots of good information to come about how to best achieve that.
Thank you so much, Catherine. That was really, really helpful. And I'm going to say again, for those of you who have questions, try to put it in the Q&A because it's a little bit easier for me to keep track of, because the chat is in a constant movement of people just saying hi to each other. So if you have a question.
So I think Jackie Dillard-Fost asked a question about how do you get to senators? Do you want me to chat about that a little bit? And somebody else should feel free to weigh in. California's lucky because Nancy Pelosi is the leader of the House, the Speaker of the House. And so she has the opportunity to put forward a package, which she has done. It hasn't actually been approved by the House, but it is a House proposal, and it is likely it will pass the House. But the Senate is quite reluctant to take that up. So in California, we have 2 senators. My belief is those 2 senators, Dianne Feinstein and Kamala Harris, will support that, which is why I say, if you have relatives in other states that have senators, if you know someone who happens to be in Kentucky, where the leader of the Senate is, Mitch McConnell, reach out to your relatives in other states and talk about the importance of the Senate doing right by all Americans and people with disabilities in particular, and passing that, that package that has been proposed by the House.
Thank you. A couple more questions have come in. Could you please explain what is meant by the rollback of SSI? What does this mean in dollars?
I don't know that I know the specific number. So SSI currently has a benefit level that's, you know, a bit above 800 a month for just SSI. It has 2 parts. It has a federal part and it has a state supplement because it costs more to live in California. Theoretically, the state supplement could be increased every year to help people sort of stay up with the cost of inflation, but the way we haven't really done that lately. And instead, what we have done is rely on the federal government to do a cost of living adjustment. So the proposal is that if the federal government doesn't do a cost of living adjustment for SSI, then because we didn't get that, there can actually be a rollback to a lower amount of SSI in California, because there wouldn't be a way to fully pay for the state supplement.
Okay. Dan is asking, under the dental reduction, I also saw services such as audiology, speech therapy, physical therapy, and OT being cut or dropped. Did I read this correctly?
That there are proposals that would do all of those things, yes. Hearing aids, I think, are another one. There was a proposal to provide increased access to hearing aids, which are so important to people in terms of being able to interact with their community, which I think is already off the table because that was a new proposal. But then there's proposals to reduce the level of other kinds of services under Medi-Cal.
Hey, Catherine, if I could just clarify, I've heard some confusion amongst the self-advocates I've talked to who have seen that and thought it meant all speech pathology, all occupational therapy would be dropped. My understanding, it's not those who would be served by the regional center through those services, but just those who are receiving just from Medi-Cal.
Well, and I think that's always right, Erin. So if you are receiving, because we rely in this system, regional center system, on generic resources, right? So if your service wasn't available through Medi-Cal, you can always get it from your regional center because your generic service isn't available, right? So I think that's what you're asking. So you would be less likely to be cut.
So there's, I mean, you know, because you were part of writing the law, the self-determination program is very, very important to many of the people who watch our webinars. And Richard asks, do we know if the self-determination budgets will be impacted in any way? Those that are still to be calculated based on historic costs.
So there isn't any language that says we would change the historic cost. And personally, if I were in self-determination, I would get my budget done as soon as I can because it's based on last year's expenditures. And what we don't know is if California doesn't get the federal money, what additional cuts might be made in the developmental disability system. So it's to people's advantage to have the budget based on last year's expenditures because that will be higher. It is, you know, there isn't anything that specifically says self-determination is going to be cut by a specific amount. I think it depends on what happens with this federal additional money and why we all need to work so hard for ensuring that that happens.
Yeah, I did ask that question when we met with DDS yesterday, and from what they're thinking, although they said that, first of all, they said there's going to be a small work group that will probably only meet once that will discuss how the self-determination program might be impacted. But what may happen is if we don't get the federal funding and the rates are decreased, that your budget is based on services you would get in the traditional system. And so if the rates of those services go down, your budget may in fact be impacted and would go down based on those new rates. So, so people in self-determination should be prepared and know that it may impact you as well. I'm just going to go to one more question. Was CalFresh food stamps impacted at all?
CalFresh is not impacted and actually will probably expand because of the number of people who do not have money to buy food.
Okay, great. And Department of Rehabilitation, did that get any cuts? I don't remember hearing.
I actually haven't looked. The Department of Rehabilitation is almost entirely federally. I mean, it's probably 2/3, I think, 3/4 federally funded, so much less likely to have a reduction.
Okay, great.
I guess
right,
I'm gonna say one other thing. There's actually one proposal I want to that the Senate came out with, which is a proposal to provide additional rental assistance to people who are unable to pay their rent and who face the possibility of eviction. And so one of the proposals that will be considered is whether to move forward with a mechanism that the Senate has proposed that would give people up to 10 years to pay back the rent that they currently owe, which if people's working hours have been cut or they've been laid off, we certainly don't want to increase the number of people who are homeless. And so this would provide a mechanism by which renters and the state and the landlords could work out an agreement where the state would sort of guarantee the amount of rent that's owed through some means that we don't have to get into here, but give renters a very extended period of time to pay back the money, with the state guaranteeing that those payments would ultimately be made.
The final thing I just want to ask you, Catherine, is to go over the timing of when this budget's got to be done. What happens if the federal funding doesn't pass before the state budget needs to be done? Just go over the timing for me.
Okay, so the timing is really short. So today is May 15th. I believe the constitutional deadline for passing the budget out of the legislature is June 15th. So 30 days from now. And that ideally the state wants to know that by July 1st, they will be getting additional money from the federal government, even if that money isn't, physically in hand yet. So I really think this is something we have to work hard on for the next 30 days.
I agree. And so speaking of that, stay on for as long as you can, Catherine, please.
Okay, I will. Probably 5 more minutes. And Aaron is also an expert on what's happening with the state budget. So I'm sure he can weigh in about any any proposals.
Wonderful. Thank you. So I'm going to move on. Thank you, Catherine, and thank you for representing us, continuing to represent us. So now I'd like to introduce Erin Carruthers, who's the Executive Director of the State Council on Developmental Disabilities, who's also a partner, a federal partner of Disability Rights California. And so Erin, I've asked you to, talk about how you see the budget playing out and sort of the advocacy that that the State Council will be working around.
Great. Thank you, Judy. I really appreciate it. Catherine, thank you so much for giving an overview of the cuts and what we should expect. Judy, I want to go back to your opening comments, because you said at the beginning, we didn't think this isn't as bad as what we were expecting. We were expecting some really devastating cuts. And when we saw it, we thought, oh, this isn't so bad. That's not helpful for those who be facing the cuts. Any cut's a bad cut. But when there is a $54 billion deficit, everybody's going to have some cuts. I want to talk about how does each person on this call come to their own determination as to whether or not this budget's okay or these cuts are okay. Some of the criteria and guidelines and fundamentals that the council uses when deciding is this good, is this bad, how do we think about it? A couple of pieces. Has the pain been shared equally throughout the budget? So when we look at the cuts in our area, we also look at the cuts in the other areas of the budget. And is it disproportionately impacting people with disabilities? Are families with disabilities, people with disabilities, paying the cost for these budget cuts? So I looked into that. The answer is no. Actually, Health and Human Service is the only area of the budget that is getting an increase. Every other part of the budget is getting a cut and a decrease. So that increase is largely driven by caseloads. They're expecting more people will need services, and they're ready to respond. They're ready to provide those services and fund those services, and that's a good thing. They're offsetting some of those services with other cuts that Catherine talked about, programs being pulled back, ready to implement other cuts if they need to. So then I thought, well, how about DDS? Maybe they're taking a big portion of the cuts within Health and Human Services. But Health and Human Services is receiving an 8% increase. DDS is receiving a 9.2% increase. So it's not even following specifically to the DD programs. By that, I conclude the governor and the administration has really looked out for us in the community. I think they've tried to minimize the impacts to us as much as possible. Doesn't mean there's impacts, but in the whole, look, this governor proposed to close 2 prisons. I can't remember the last time I've heard a governor say close prisons. Build prisons, sure, but close them, no. So the governor has taken some very hard choices, and it's not on our backs this time. So there's a sigh of relief there. The next issue we look at to see whether or not how do we judge this budget, is the standard of, is the state maintaining eligibility? Are they tinkering with the eligibility criteria so that people who would be eligible for services before aren't eligible for services now? It's often a tool or a trick we see in other states that are used. Just keep shrinking who can get through the door to get services. The answer is no. Again, they're expecting an increase of people who are needing the services. The increase for the DDS budget is $775 million. So $750 million is what the governor's proposed for next year. So even though there's cuts, the overall expenditures for DDS increases. So they're not tinkering with eligibility. This is a good thing. The other criteria we look at is whether or not the cuts are specific. Be specific is a good standard. Sometimes they just cut and they say, you figure it out. Across the board cut, you figure it out. We're just going to take this amount, we're going to take $1 billion and you figure out where it's going to come from. This leads to confusion, disarray, fighting. So the more specific the cuts are, the better. Catherine went over those, and I think all in all, they're pretty specific and they're pretty clear, but there's one area that I think is a little unclear, and that leaves actually an opportunity for the members, the people who are joining this call. The one area is if we don't get the funding from the federal government, there's proposed to be a $300 million reduction in provider rates. I've been listening really closely to hear, if that's described, and what does that mean? I heard the secretary yesterday say they would just roll back the 8.5% increase in provider rates that were given last year. I've been listening for other places to see if that's confirmed. I haven't seen that in writing. I'm still looking for that. But I think that that area is an opportunity for the members on this call, because it gives you the opportunity to say, here are my values. Our values, our view, our vision for the system, just to roll something back to where we were a year ago, or our values, our view, our vision for the system to actually move it forward into a new direction. I know everybody on this call is committed to community services, services in the community, in the homes, inclusive services, integrated in the community. When we look at a $300 million decrease, I think it's smart strategy to look at where are those cuts and prioritize those services that actually provide those integrated services in the community. It's an opportunity. It's a way to enter into this conversation and say, if you have to cut, you should prioritize these. Don't just reverse the calendar back by a year, but be strategic. Make those cuts in ways that move us forward to the vision that we share. So Catherine said there really is an opportunity. The other opportunity is looking at the federal government. So all the cuts that we've talked about, any cuts that have been talked about related to the budget don't happen if the federal bailout comes. The governor's asked for $1 trillion. Of the $1 trillion, I wish I could see, like, do a poll really fast. How much of that $1 trillion do you think California needs to prevent cuts? They are asking for $14 billion. $14 billion out of $1 trillion. So that's like $14 out of 100 is what they're asking for. And that number is really reasonable. It's really reasonable for, I'm sorry, it's 14 of 1,000, not 14 out of 100. So that number is really reasonable based on the total needs of states overall, of cities overall, of tribal countries overall, to respond. We're really, really lucky that we've recently been through some recessions. And those leaders that went through it before said, we're going to do some things to make sure that next time it happens, the pain won't be so hard. This $54 billion is a huge number, but percentage-wise, it's not the biggest the state has dealt with. In 2009, the deficit was 58%. In 2003, it was 45%. This deficit is 37%. So it's hard, it's bad, but it's also manageable. And the prior leaders gave today's leaders some tools to navigate through it. So I see that my 7 minutes is up. I want to stay on time, but I also want to let you know that the focus, the message, everything that we're putting out there is focus on Congress. Hopefully you saw our broadcast that we sent out last night that told people to message Congress, the House, the Senate, wherever you can do. If you haven't received that, if you didn't get that mailer directly, I just put in the chat. You can link on that. You can post it on social media, because if that money comes from Congress, all of these cuts off the table, they're done. Conversation over. Thank you.
Thank you so much, Aaron. And I want to just reiterate what you were saying and what Catherine was saying about Congress. We have the House of Representatives is likely to pass these funds possibly in the next day, where it would provide this $1 trillion to the states. But it's going to be passed on a partisan vote, and in the Senate, it's controlled by Republicans who are looking for a compromise and are not willing to pass the same bill. And so we really need to focus on our senators, and our senators are going to be great here in California. We need to focus on senators outside of the state. So if any of you have family in, particularly in Republican senator states, now would be the time for them to be calling their senators and saying, the states need your help, and to put a lot of pressure on them. So hopefully everybody will do that and join the mailing list of both the State Council and DVU so that you can get some of this information. There continues to be questions that I'd like to pose to you, Aaron, about the specifics on the budget, if that's okay. Oh, first of all, I want to say, because there's been a couple of questions about the recording, we are recording this webinar. It will be available on our coronavirus website, and we will be emailing it to everybody who's on our mailing list. Just so that you know, the coronavirus resources website we've created is disabilityvoicesunited.org/CV, as in coronavirus, CV. So please go there, and we'll put that in the chat, that website. So could you talk, Erin, a little bit more about the uniform holiday schedule and how that impacts people and what kinds of services are not being paid during those holidays?
This is an area that's pretty important to providers, but it's also important to families too, because it impacts us. I see Mark nodding, and I think he might actually be more of an expert on this since he deals with it directly. So Mark, I'd be glad to pitch it over to you.
Oh, there you go.
Thank you, Erin. I'm not an expert, but certainly when those reductions happen, it does impact folks in supported living who also rely on in-home support services, folks that would need those hours covered by supported living, which at a cost to the state a little bit more than what the IHSS services would cost. But like you said, I think it really highlights the need for families who are needing that break, needing that support for themselves possibly, and for their adult child or in their home. So, I mean, it does impact. Many of those IHSS workers are people of color or low income and desperately need those jobs. So it's also cutting the wages of the employees, that workforce. So it does have additional impacts after that cut. There's no sunset date on this particular cut. It's stayed on the radar every year, and I think even one year it went away, and now it's back again. So I mean, I think it will always be something that we'll be seeing fluctuate back and forth as the economy does well and as the economy doesn't do well.
Thank you, Mark.
Just very simply, it's just a standard schedule of forced holidays called holidays. So providers aren't providing services, they're not being paid, and families aren't getting services for those days.
Oh, holidays. I jumped over to IHSS. I was thinking about both of those cuts. The holiday schedule that nobody really understands is similar. That there's now 14 days where services, probably day services aren't provided, employment services are. But if folks need that support, then that would need to be covered by families and providers of supported living services. So thanks.
Erin, this may be one for you. What about that early intervention funding that was included in the current year's budget because it was accidentally left out last year? If the federal money does come through, do you think that proposed rate increase would be considered again for that early intervention?
No, the way the governor structured his proposal, that falls into the category of solutions that he proposed for this year that he's withdrawing. The rate increase, if we get money from the federal government, it would only keep us from doing these extra cuts. So the way the governor structured it, proposals fall into two buckets. I proposed something in June, and now I'm pulling it back. Those won't come back, even if we get money from the federal government. The other is, if we don't get funding, we're going to do these additional cuts. So think of them as 1 and 2. The funding for early intervention, for infant development, for independent living services, employment services, you could say they were left off. I say it was a mistake. It was the product of a rate study, and the writers of those rate studies have said, we made a mistake in our calculation. They should have gotten raises. They didn't. And that's why the governor said, okay, we'll go ahead and fund them. But now they've been enshrined into this. They didn't get the funding, they didn't get an increase, and now as we move forward, they're just sort of stuck in this other area of an error that just keeps perpetuating. So as individual members are thinking about things they can do to advocate, that's another good one.
Thank you. I just got a text from Nancy Bargeman that she's going to be joining us. So we're just working right now. In fact, I will just do it because I was texting you, Ed. Ed, if you can, I'm not sure if you can get a presenter link to Nancy. If not, she can join in as a panelist and I can elevate her to a presenter. So Nancy will be joining us very soon. I'm going to move on then to Mark. Oh no, who is next? Allison. Sorry, Allison. But I need to warn you, you know what, actually, since she's going to be joining us in a second, I'm going to continue to take Q&A so that nobody is having to interrupt their presentation. So we have 23 questions in the queue, so let's get to some of those. Is there any mention in the budget cuts about the minimum wage increases and whether they will continue as planned? Mark or Aaron? I feel like they're not.
There's two parts to the minimum wage. One is, are we going to mandate minimum wage payments for the private sector? And then are we going to backfill minimum wage payments for DDS vendors? I need to look into it further. I don't want to give you an answer one way or the other, but maybe others have looked at that.
The funding is in the May revise for the SB3 to continue on the path that it's on, to raise $1 every year. So that has not been taken off the table or suspended. That is going through and it is funded.
Great, thank you. Let's see. I answered that. We answered that. We answered this. This is so good. Hold on. There was one that Connie Boyer-Frenzel asked that you answered, Mark, but I want everybody to hear the answer. She was asking about, for those who are receiving IHSS, who are now going to be subject to the 7% cut in hours, what are they supposed to do with those hours? Can they get those hours backfilled by supported living services at the regional center or respite for those who are not in supported living?
Sure. For all of those things, the reduction in the 7% reduction in the IHSS hours, the 14-day holiday schedule, everywhere where they're losing supports, individuals will work with their case managers on increasing supports for the supported living provider, so that those hours are continued to cover for somebody who needs those hours. So that would be the path to take with any of these reductions that are coming to physical supports. Those person-to-person supports should definitely be addressed with the case manager to talk about what's going to supplant those, and that would probably be the increase in hours in the supported living providers' hours.
Great. And then providers are asking about the, well, so no, this person is asking, do we foresee a across the board rate cut for those, for that $300 million? Is it going to be the same with everybody? Is there a likelihood that programs that are considered more essential, possibly SLS and adult residential, receiving less drastic cuts, while others that are not considered as essential during the crisis being subject to greater rate cuts?
Yeah, I think that what I heard from the secretaries, they would just roll back the 8.5% that was given last year. So they just turn the calendar back and undo what they did. But that's where I said, I think there's an opportunity for advocates to be strategic and say, actually, you should continue funding certain services at different levels.
Okay, Nancy's about to join. Okay, so I'm sorry, I'm just texting her so that she's about to get on. Okay, finally, let's see. Somebody's asking about the 14-day furlough. Do you think that they're talking about the uniform holiday schedule? Okay, so we've asked that. Oh, here's a question. I don't even know what this means. Rachel Shepard is asking if the CTAP and DDTP are affected. I don't even know what that stands for. Does anyone know what that stands for?
Rachel, we need plain language.
Have you heard of, has anybody ever heard of the CTAP and then DDTP? Okay, Rachel, if you could type in what those stand for, we could try to answer that for you. Let's see. So some of these questions I'm gonna pose to Nancy. Oh, some people are asking if we could get a script for what we should say to the senators. Is that something, Erin, that you or others are working on so we know exactly what to say if we're calling Senate offices?
Yeah, if you look at the social media link that I put over in the chat, and please share that broadly, what the council encourages is people to just call them and tell them their stories. How is COVID impacting them? How would these budget cuts impact them? What's the need? What happens if Congress doesn't help states out? So we haven't given people a specific script. We don't. It's not our philosophy to say, you say this, go there, say this. What we do is we support people to tell their stories. So that's what we've been encouraging. But others certainly may take a different approach.
So we have just gotten the definition of DTAP and CTAP. It's the Deaf and Disabled Telecommunications Program and the Coronavirus Treatment Acceleration Program. I must admit that I'm not sure about either of those. Does anyone on this call, on this webinar?
Yeah, Rachel, I know those programs, and I apologize that I didn't recognize the acronyms immediately. I didn't look into those programs to see if they were impacted, so I apologize. I don't have an answer for you.
We can try to find that information out, though. I don't remember it when I was reading the summary of IHSS. I don't recall that being in there, but it could have been.
Probably would have been in rehab. It probably would have been rehab. I think they're largely federally funded, as Nancy was talking about. I'm sorry, Catherine was talking about. And so, again, I wouldn't want to tell you unless I know one way or the other, but it's likely that they're okay.
Great. Okay, I'm feeling like I'm not sure when she's coming on because she continues to text me. Oh, here she is. Yay. All right. Yay. Thank you, Nancy, for coming on. I was trying to tell Nancy what's been going on our webinar, but first let me introduce you. This is Nancy Bargman, the Director of the Department of Developmental Services, who has just a few things going on right now. So we really, really appreciate you coming on. We have almost 500 people on this call. So I think there's a lot of people who, probably have a bunch of questions for you. We had Catherine Blakemore on early on in the call who went over a lot of just very briefly over what things have been taken out of the budget that were proposed for this year, as well as items that were going to be cut. And so I'm not going to make you say the same thing again. I think she did a pretty good job. And I think Erin Carruthers, who's on, has also talked a lot about it. We spent a bit of time talking about how we need to get more federal funding, and I know you support that as well. So, how's your day going? I'm sure you've been busy, but one of the people are worried, there's a lot of family members on this call, and they are worried about how this might impact them. So, just kind of in your opinion, how will this impact the average individual served by a regional center and the average family? What should be our concerns?
Sure. No, thank you, Judy. And again, thank you for inviting me. You're always so good about giving me some time on the work that you're doing with the community and stuff. And so I appreciate having a moment and being able to join you all. Those are really good questions. And I wish I had a really simple answer to say, what is all the different impacts, because it's so individualized. We're very fortunate, in California, we are able to serve, just over 350,000 individuals in California. And we serve individuals from, early start at risk, all the way up to, we have some individuals who are over 100, and so the service needs and supports needs are all very different. I do want to just kind of share, and I know that Catherine and then Erin and others are going to do a fabulous job in being able to provide kind of that framework of what the May revise is, and, certainly talk about what was proposed in the governor's budget and then what's been withdrawn and kind of going forward. I do want to just kind of put into context, because I think it does answer a little bit of your question, is to when we're taking a look at some of those difficult decisions as to what are we going to need to look at as far as cost saving measures or to other strategies such as increasing federal opportunities with the federal billings and increasing our federal match. it was important to take a look at what were some of those strategies and the values and the principles that we have been informed by over the last couple of years, putting forward new policies or new things, because it's all been based on information that we've received from the community. So being sensitive to those really important issues of inequity of spending, our disparity issues, looking at our safety net for individuals with high risk, you know, whether it's kind of the medical needs or those co-occurring issues, you know, taking a look at how we can make sure that we're supporting our system and our caseload growth, accountability and oversight, you know, making sure that we're responsive to families. And I say that because as we had looked at our proposal and may revise, I use that as kind of my lens to say, okay, these are all very difficult proposals to put forward, but we had to consider some of those families, especially that are getting impacted by multiple systems, if you will. So we know that many of the individuals that we serve, they're in school, they receive regional center services, they have IHSS, you know, they have all the different services. And so as we're looking at the impacts, it's like, how do we help kind of mitigate some of those things? A good example of this is that when we were looking at some of the past strategies when we had the recession, many folks who we all kind of lived through some of those things, and some of the decisions were very hard. We had heard very strongly through the advocacy of many that to restore early start, because that was one that was really important to people. So really looking at it this time going, wait a second, let's make sure that we're really being sensitive to, you know, if we were to, you know, implement the same reduction or strategy this time, and the schools were also facing some reductions, what would happen to those at-risk populations under the age of 3? So those were things that we didn't do, so we can make sure that we were minimizing those impacts. So the areas in which I want to make sure that we're all sensitive to and working together on is how do we identify the areas of where the multiple impacts are impacting people. So, or how can we measure that? Can we do some surveys, you know, kind of moving forward in with the families that may be receiving less supports and resources from not only developmental services, but are there less resources and supports in education? And working together to identify some of those impacts and what can we do to help mitigate any risk or certainly mitigate risk for those families. So those are the things that I think we have to be very mindful of as we're implementing some of these changes. Communication is even more important. Not only communication, what we're doing, making sure we're transparent in the decisions and when things are available, making it available to the community, but then also back to us. So like I've said before, these opportunities to have you share, have the family share, working with other groups to share the things that are difficult and important to families is what we're going to want to hear as well.
Thank you, Nancy. Do you have a few minutes, because there's a number of questions that have come in that you would be great to answer. The cuts that, let's make the sad assumption that the cuts have to go through, then we don't get the federal money. Are these permanent cuts, or can we ask for these cuts to be sunsetted at a certain point, assuming that the economy will rebound at some point?
Yeah, so the trigger, you're talking about the trigger, and I'm sure that Catherine and others have talked about that. And within the proposal that we have in May revised, 4 of the cost saving measures are attached to those triggers. So if the federal dollars come in, that there may be opportunities to kind of repeal those or reduce them. So the other ones that are not, or the different strategies, as far as sunset dates and stuff, the administration's not proposing those sunset dates. But I will tell you that one of the things that we wanted to make sure when we were putting forward, and it's been very important through this administration, is to say, how are we supporting that caseload growth? And it's not just within developmental services, it's within IHSS, it's within other services, because the infrastructure, kind of the foundational things that we do are really important. And so when I looked at developmental services as far as the cost saving measures, it's like, what is it that's foundational that we know is very sensitive, but at the same time, if we have the opportunity, like on that outside, looking down the road as we kind of get our forward thinking about how do we kind of bring back up things that we may want to restore, to really look at the structure to say, how do we make sure it's there to be able to build back up? The other part that I would add, though, is what are the lessons that we're learning now that actually we may want to continue, as some of the strategies. So, and I apologize if you guys have already heard me say this, is that we're learning that teleservice or some of the telework in some areas actually might be a really good resource, and so those are the things that we're going to also want to do, is to say, what is working in some of the kind of the new day that we have in managing through kind of the COVID response. So we're going to have to do some lessons learned. What's good, what's not working, what are some of the policies and strategies that we may want to take a look at continuing, and what are the ones that we're going to want to take a look at building back up, or maybe do it a little differently.
Great, thank you. Eric is asking this question, which I'll read because I'm not sure. I'm not sure where he's getting some of these numbers from, so I would like you to confirm them. The DDS may revise highlights proposals. It proposes a total savings of $470 million from rate reductions and service expenditure reviews. I assume that means reducing client utilization. Do we have any idea how much of this $470 million would likely come from reductions from client utilization versus provider rates?
So the 470 million, I believe that's the total fund of the 300 million that is in general fund. And so it is kind of bundled into three different categories. One is identified as the rate reductions. The other is utilization review and expenditure reviews. And so we do have, and there's going to be trailer bill language out shortly, to where folks will be able to see a little bit more into detail into kind of that breakout of what the assumptions are. So the majority of kind of the assumption of the 470 million total fund and the 300 million general fund is really in that category of rates and the reductions or payment reductions. And the utilization and expenditures, there's a smaller portion of that we're going to want to engage conversations with self-advocates and family members and providers to say, what are some of the streamlining or strategies we can look at that may be different in our approach, so that we can use as some cost-saving measures. It's going to be an area in which we may also have an opportunity to look at, are there some standardizations or continuity that we may be able to do in some of the services. Like I said, when we're looking at the issues of inequity or disparity funding, across regional centers or different service types, this may be an opportunity for us to take a look at some of those things and say, can we standardize some things and have a benefit of streamlining, but also have a benefit of kind of addressing some of those differentials between regional centers throughout the state. So more to come on that. We're going to have some discussions and that we're going to be able to engage with folks.
Great, thank you. There's a couple of questions that people have that are not related to the budget, but that are related to the current COVID situation that I'm wondering if you wouldn't mind answering. Hold on, let me go find the one that somebody just had. People are asking about that recent DDS. We have a lot of different kinds of people in our audience, including a lot of service providers. Mm-hmm. And so people are asking about that recent directive that came out about the payment protection program versus people, I guess, service providers billing directly. So would you mind just saying just a few words about it and how that's gonna play out?
Yeah, so with the, it's really about the retainer payment. And so we have in our regulations where in a state of emergency, the ability for providers to claim absences that is above their prior 12 months of absences. We were able to utilize that regulation with the state of emergency that was issued in March. As we have continued to move forward over the months, we were able to start getting some additional guidance into what we're looking for with kind of those steps of services and making sure that we're using the opportunity of our non-residential to support kind of alternative approaches. You know, the non-residential providers started getting very creative and thinking about how can we be supportive, you know, as we're having to use alternative remote supports. So we're looking at, because a lot of providers had questions on what is it that I need to retain in my documentation? And so the additional guidance was really intended to provide that guidance for that documentation. And each month as we've kind of moved forward, it's been important to provide additional clarity. And there has been opportunities for providers. Many questions that came to us is that if, you know, can I apply for payment protection? Can I apply for some of the small business relief issues? And so with those questions, we wanted to make sure that, yes, absolutely. You know, those are things that we're going to want to make sure that we're all maximizing the opportunities that are afforded to businesses that are facing some challenges. So we're going to continue to provide guidance. We'll likely have more because each of the directives are good for 30 days. And so we'll continue to provide those updates if we're doing any additional extensions on any of those directives.
Great.
Yeah.
Here's just a quick question. The disparity grants, the funding for disparity grants, is that still in the budget?
Yes, so we were able to retain quite a few things in the budget. So in addition to our caseload growth, which we experience every year between 13 and 15,000 individuals, we're able to support in the May revise the funding for those additional consumers coming into our system, as well as some of the expenses that are related to all of that. We're also able to retain and to continue the CPP funding to help with the development of new resources. Also with the HCBS funding to help providers get to compliance, as well as the disparity funds, the $11 million. And so we do have all of the grant and the startup programs still continuing in projected in budget year if those things are approved through the budget process.
Great. Here's one that's
Nancy, Judy, if I can add to that, Nancy, another thing you were successful at keeping in there that's really important to this group is the funding for the local self-determination advisory committees, the federal match on that. So that's great. Thank you.
You're very welcome.
This is a question related more to the coronavirus pandemic. Now more than ever, people have a need to access generic resources, and those resources that are beyond the regional center services. But a lot of people are having problems accessing those for a range of reasons, and really could use help from their service coordinators at regional centers to help them access it. Is there a way, and in some cases, service coordinators don't have the kind of broad-based knowledge of how to access it, especially since it's different sometimes in different counties, in different school districts. Is there a way to get more training for service coordinators to understand how to access these generic resources, especially during this time that it's so critical?
Yeah, we are finding some opportunities I'm sorry, I have to just note that I'm going to be a few minutes late on something, so I'll be okay. No, I think that's okay. I don't mind. I don't multitask as well as I used to. I used to be able to do this really well. And so with looking at opportunities as far as training or looking at things along that line, I think we do have some opportunities with that. We have heard, so for example, when we take a look at maximizing those generic resources, and I had talked about this when we were introducing the performance incentive program plan, is that, you know, is there an opportunity for us to look at some specialists You know, is there, because we can absolutely do training across the board for service coordinators, but we may also then want to start thinking about, is there a way to help some staff at regional centers and others to become a little bit more specialist in, say, IEP meetings, or specialist in kind of managed care and navigating the health plans, and somebody, you know, so you want to be able to have a very good, strong generalist base of knowledge that we can have across the system. But we then may need to say, well, wait a second, where do we build up that knowledge-based muscle a little bit more? You know, so service coordinators have a resource that they can access to help then connect families to those services. So we look forward to try to come up with those ideas and things we can implement as we're going to have to kind of coalesce together to see how we can help be able to connect families to those generic resources, both in other systems, but then also locally within their community.
Thank you, Nancy.
Yeah.
Here's a self-determination question, because, you know, we have a big determined audience.
Yeah.
Is the funding for the initial person-centered planning services going to be available, continue to be available for people moving into the self-determination program?
So as of now, we don't have any changes that have been identified for self-determination. So as all have been kind of moving forward, at this time, we don't have any proposed changes.
Do you know, I mean, this is not related to this budget, but do you know whether when the self-determination program goes statewide, will would that funding for that initial person-centered plan be able to be accessed through regular POS like it is for people in the phase-in period? Do you know if that will continue on?
I'm not sure. We haven't really given kind of the planning and thought to kind of those next steps, but certainly that's going to be important to add to our items that we're going to have to make some decisions and policy decisions on, but those decisions have not been made yet.
Okay, great.
I probably have time for one more question.
One more question. Okay, this person specifically said your name in it. Thank you for bringing up oversight and accountability. I hope that along with transparency, it will be built into how DDS continues to fund regional centers during this time. This week, I heard of yet another service provider that cut their employees' salaries and pay, even though that service provider is still getting the same reimbursement from regional centers. The employees are collecting unemployment because of this to match what they were getting paid before. I support service providers getting paid, but there needs to be more oversight, accountability, and transparency. With so many people needing to file unemployment, it's really important the funds are there for those who truly need them.
Yeah, we're always going to want to take a look at what are the areas in which we can enhance. You know, the accountability and oversight is important. And we are always looking at that, you know, but I also want to say that one of the other things that we're going to need to make sure as we're moving forward, in addition to the accountability and oversight, is then also those outcomes. You know, while we do have proposals in the May revise for cost reductions, it doesn't mean that we should not pay attention to those outcomes and make sure that we keep our measurement of both monitoring, accountability and oversight, outcomes, you know, what is the meaningful life of an individual. But then I also recognize the importance of, as we're working through all of these things, are there some kind of reporting out and things that regional centers and others are having to do that we may need to say, well, wait a second, what's the value of that? And make sure we raise up the value of the other things that are going to provide those protections. So we're going to have to do kind of a check into all of the things that we're doing to say, what can we and should we say, okay, wait, that may be taking a little bit more time and not as much value, and increasing the things that are going to get greater accountability, but be sensitive to all of the important things that we're talking about. So I don't know if that makes any sense, but it is a time for us to do a check and balance on all of those things. And to that point, as far as the question that came up or the comment about, you know, how a particular provider is managing that, those are the things that we're also taking a look at.
Great. Well, thank you so much, Nancy, for joining us. And I hope
Always
we get
a
a little
pleasure.
hand.
Oh, always a pleasure to see you guys. You have a great meeting, and thank you again for giving me a moment.
Thank you
Okay.
so much.
Bye.
Take care. All right, we're going to go back to our lineup.
Hey, Judy, can I add one more piece?
Yes.
Regarding the question regarding generic services and how to access them, I want to make sure people on this call know that your local State Council on Developmental Disabilities office, the regional office near you, is expert in this. In March, we fielded 10,000 people who are asking questions. Great boom, and how do we get to generic services? So service coordinators certainly have a role. It's part of their statutory mandate. They should have a good general foundation in it, but if you also need help, the State Council is there for you too.
Thank you, Erin. Very helpful. We're going to move on now to Allison Morantz. Allison is the director of the Stanford Intellectual and Developmental Disability Law and Policy Project. And she's going to be speaking to everyone today about that really critically important federal matching funding that that many of you receive. And she's going to explain it a bit in a way that hopefully we'll all understand. So thank you, Allison.
Okay, I'm trying to get to my PowerPoint. Give me one sec. Okay.
That's a wonderful website.
All right, I have no idea what it was, but anyway. Okay, so I want to make a little bit more concrete for people something that other speakers have referenced, which is about Medicaid dollars or federal reimbursement. You've probably heard that term. I think it's been used a couple times today and certainly is in other contexts, to just give you a sense of what that's about, because that's another thing that actually is not a result of coronavirus. This has been kind of an ongoing issue for a number of years, but I think because of the pandemic, it's become more front and center and more urgent, because particularly in the scenario in which the federal funding that everybody's been discussing, despite our best efforts, doesn't come through, it will become all the more important to ensure that we're maximizing the uptake of federal funding. And so coronavirus or no coronavirus, I think it's a really important issue that I hope this will help you understand for those of you who are not necessarily familiar with it. So I just want to start out and just to sort of set the groundwork and note that California's regional center system relies heavily on federal money. It didn't at the very outset. Here's a graph to kind of show you how things have evolved over time. So federal reimbursements, that's the green part of this graph. Blue general fund, that's state money. And then the yellow is a very small amount of money from other sources. So what we're focused on here over time, and notice that, at the bottom, that's, increasing from 1981, pretty early on in the regional center system, to a couple years ago. It's not exactly up to the minute, but it's pretty close, 2017-18. And note that in broad strokes over the last, several decades, federal reimbursements have become increasingly important. They were not important early on. Right now, they're a little less than half of the total funding of the system, but in the 40s, very important. So ensuring that we are drawing down as much federal money as possible is really an important part of ensuring the vibrancy and long-term health of the system. So the key thing is that the only way for the state to draw down federal funding, and by the way, it's about 50 cents on the dollar. It could sometimes be more than that, but it's at least 50 cents on the dollar right now, is to enroll regional center consumers in federal programs. Okay, and basically if there's no federal enrollment, then there's no federal money. And it's really kind of that simple. I mean, in some states, you can only access services if you access federal money. But what makes California special is that we have a state law that gives people an entitlement to services, which is vitally important and unique, and something that, that we're all, I think everybody on this call is fully committed to protecting. But what that means is that some people in California can get services under state law without actually recouping any federal money. So the question becomes, how do we enroll regional center consumers who live in the community? How do they enroll in federal programs? Okay, and just to boil it down to its essentials, there's really three critical parts to that. And again, I'm assuming these are people who are already covered by their regional centers and they're already living in the community. That's my assumption going forward. So first, they have to enroll in Medi-Cal. They have to have at least one eligible service. And the term that's usually used there is POS. You might hear that a lot, and that stands for purchase of services. And it has to be one that can be reimbursed by the federal government. And the third thing is that the consumer has to consent. And consent can take different forms. Sometimes it's just sort of signing a form. And the most important federal program, the one that accounts for most of the money that we receive for the federal government, it also involves something called institutional deeming, which some of you may have heard of, which is another form of consent. And we can't get federal money unless consumers basically sign those forms. So those are the 3 steps that are necessary for recouping federal money. So about how many regional center consumers are getting money through the biggest federal program, which people usually refer to as the waiver. And it's good to know how well are we doing in terms of drawing down federal funds. So that's what this chart is trying to show here. So right now, if you look at the trends over time, we're at a little bit under 50%, about 47%, give or take, depending on which sources you look at. So that means less than half of active regional center consumers, those are the most relevant group, the ones that usually live in the community, are enrolled in the waiver, which again is by far the biggest source of federal funding. And so that raises the question about how much federal money is being left on the table. And another way of putting that is how much additional federal money could we get if we enrolled more people in federal programs, most importantly, the waiver. This is a really complicated chart that's full of a lot of numbers. So don't be too daunted by it. I'm going to walk you through really quickly what it means. So on the far left column, if you look at the highlighted number at the bottom, it says about 277,000 consumers. This is a couple years out of date, so the number's a little bigger now. But the idea is that's the number of more or less, it's a little higher, but about the number of people that are regional center consumers and they live in the community. So they could get federal money, potentially, if they went through those additional steps that I mentioned before. Okay, and there's about 277,000. And then when you look at the subset of those who get at least one POS, that's at least one service, and also get Medi-Cal, then that number 277,000 falls to only 182,000. So you're losing a lot of people. You know, you're at about 2/3 at that point. And then when you look at that far right column, the percentage who are enrolled in the HCBS waiver, that's the biggest source of federal funding. Like I showed in that last slide, you're only at about 47%. It's less than 50%. So the point is that we're losing a lot of people along the way. There's a lot of people who we think could get on the waiver or another federal program, but are not doing so. And if we think about how much money, you know, try to do some back of the envelope calculations, which I'm going to say right off the bat are not perfect. There's, you know, they're the best we can do with the data that we have. It's possible that a lot of money is being left on the table. Okay, and I have a report in which I go into a whole lot more detail about this, but the gist of it is this. If you identify the number of consumers that seem like, you know, sort of feasible for them to draw down federal money, like they're already getting POS, right? They already have services, they're already in the community, they're already clients of the regional center, but they don't necessarily have Medi-Cal, right? And you know, kind of how, or maybe they have Medi-Cal and POS, but they're not getting federal money. There's about 80,000 of them. And then if we use some round numbers in terms of how much money we might be able to get from the federal government for each of them, the best numbers we have suggest that's maybe in the ballpark of 10,000. And if you multiply those two numbers together, that adds up to a big number. That's about $800 million. Now, do I know the number is that big? No, I can't, because as I said before, there's some details I'm glossing over a little bit. But I think it might be in the right ballpark, and I'm not the only one to suggest that. There's an independent organization that receives federal funding called State of the States, and they publish numbers for the whole country, state by state, and they estimate that California's unmatched state, county, and federal and local funds, state, county, and local funds are over $1 billion. So that's not exactly the same number, but it's quite possible that there's actually significant amounts of money, hundreds of millions of dollars, that are being left on the table because not that many people are enrolling in these federal programs. So just to sum up, what are the policy goals? So first, it's important to get all eligible consumers who have both Medi-Cal and purchase of service, who are already receiving eligible services, either on the waiver or on this other federal program, which I haven't talked about, less important, but also useful, called the state plan amendment. Those are two ways in which we can get this federal government to give back to California at least 50 cents on the dollar. Okay, so that is the goal. And secondly, to encourage and support, and I really want to emphasize that point, support, because that echoes some earlier things that have been said today, to support all consumers who are not enrolled in Medi-Cal to do so. And then from there to enroll in federal programs. And support means not cutting them off if they don't complete Medi-Cal enrollment. It means helping them through the process. It means if they have difficulty with the paperwork, making sure they get the assistance that they need. So I'm going to leave it at that, but for those of you who are interested in a much more detailed explanation of kind of what the numbers are, where they come from, this is the website for CIDLAP, and on the CIDLAP website is the full report on increasing uptake of federal funding. And so just to sum up, for those of you on the call who are parents, and I'm also a parent of a teenager who's served by a regional center, I think that the important point is over time, and I think the pandemic has made it all the more pressing, we need to identify what the obstacles are to increased enrollment in federal funding, and one by one eliminate them. If there's psychological barriers, if there's time cost, whatever those barriers are, we need to work on them one by one so that we can mitigate right now in the midst of a pandemic, and over the long term, we can mitigate the risk to the system and put it on a more stable path.
Thank you, Allison. That was fantastic. And there's a few questions. You can, everybody grab the website if you want to read the larger report. There's a few questions that have come in on this, if you don't mind.
Sure.
So this is just a general question. What are the barriers that are preventing people from enrolling in these programs?
So as a parent, so I'm switching gears a little bit now. I can tell you that every year, when we have to renew our enrollment for Medi-Cal for our son, it's always a challenge and an adventure, because every year there's a new set of challenges that's presented. Sometimes the paperwork is lost by the local, it's done at the county level, Medi-Cal enrollment. And every year, we spend many hours trying to complete that paperwork. So just the time cost is really daunting. I think, again, there could be barriers in which people don't really understand what's involved, and it might be intimidating, and they might need somebody to explain and walk them through what it means, for example, to go through institutional deeming. We were fortunate that we were able to identify people that explained, like, what is that about? What does that mean? So and I don't think we know what all the barriers are. And actually, that's part of my point. I think we need to systematically talk with people, understand why they're not doing it, and help resolve those, each of those challenges one by one.
Some people are saying in the chat that their service coordinators are a barrier, because I have to say that as you saw the chart that Allison had, some regional centers are doing a better job than others of getting people onto those federal programs. And so the budget makes some assumptions about how many more people can get on the waiver. So I don't know if you want to talk to that.
I think that's a really important point. So I want to share, am I sharing screen again?
You are.
Too. Great. So I really want to highlight the point that Judy just made on the variation across regional centers. And just to be clear, I am not doing this to call out any particular regional center. So please don't pay attention to the far left column. That's actually not my point. It's just that there is significant variation across regional centers in how successful they have been in getting people to kind of make it through the process. So if you look at the column that's the third one from the right, which says receiving POS and Medi-Cal at the top, you'll see that across individual regional centers, there's quite a big range. You know, it's from 57.5% of the total number of eligible consumers all the way to 74.1%. And then in the far right column, the range is 36.4% to 59.7%. So there is quite a lot of variation across regional centers in how successful they are in helping consumers enroll for these programs and draw down federal funding. So I completely agree that service coordinators, you know, first of all, whether they even let you know that it's an option. And I confess in our own case, we learned from a parent about getting on Medi-Cal. We didn't even learn from our regional center. I don't think our experience is unusual. So I think that absolutely regional centers need to be part of the solution, and service coordinators specifically.
Thank you. People were asking for the link to your report, even that you gave it at the end of your slideshow, but I just put it in the chat, everybody.
Sure.
So, this is the link specifically to the general website, and I put the direct link to that report in the chat, and it should, for at least for me, it is a direct link that you can just click on it and get right to the report.
Thanks. And I'm happy to talk with anybody. If you want to email me on details, I'm happy to do that as well. My email's on the website.
Great. People are asking if you could share this this PowerPoint with us, and we'd be happy to email it out and to put it on the DVU coronavirus website. Does that work for you?
Sure.
Okay, great. Okay, let me just go to Q&A because there's a few more questions for you. I'm not sure if this is directly related, but do regional centers have sufficient staffing and reasonable caseloads to perform required visits 4 times a year with waiver enrolled consumers? I don't believe that there is a requirement for all waiver enrolled consumers. I believe that that visit is for people in supported living. Do I have that requirement correct? I don't know if Mark wants to chime in, but.
I'll let Mark chime in. I mean, I think part of that is state regulations. So I'm not the best equipped to answer that.
Yeah, I'm probably not the best to answer that either, but would be good to find out to get back to folks on that. Yeah,
I can tell you, my son's been been getting waiver funding, federal funding for many years, and we do not get 4 times a year visits from our service coordinator. So that is really just a small population of adults in supported living who are required because there needs to be a check on them because they're not living with their families anymore. So that's a different, yes, somebody saying regional center must, Megan Mendez, thank you, my former service coordinator. People must visit, regional center staff must visit people in supported living and residential services 4 times a year. So, but not everybody who goes on the waiver. I'm gonna move along. I mean, there's a lot more questions, but I think that we'll be able to get to them towards the end. So I'm going to move on to Mark. Mark Melanson is the executive director of the California Supported Living Network. And he's also the co-chair of the Path Forward Collaborative, which some of you may have never heard of, but you are going to hear about it today. So thank you, Mark.
Yeah, thank you, Judy. And thanks to Disability Voices United for hosting this webinar series. It's really been so vital to our community to have access to such important information during such challenging times. And Judy, you've just done such an extraordinary job facilitating them, identifying content, securing speakers, and organizing the webinar. So thank you. So my name is Mark Melanson, Executive Director of the California Supported Living Network. That's who I'm here representing today. The California Supported Living Network's mission is to advocate for the systemic development of quality community living services for Californians with intellectual and developmental disabilities. We're able to do our work with the support of a volunteer board of directors and the 110 agency memberships who provide supported living services, independent living services, respite, personal assistance, and employment here in California. As Judy mentioned, I'm also privileged to serve as the co-chair of the Path Forward Collaborative. The Path Forward Collaborative is a great bunch of advocates working together to create an inclusive path forward to support dignity, choice, and equal opportunity for Californians with intellectual and developmental disabilities. The Path Forward Collaborative is a working collaborative of people with intellectual and developmental disabilities, family, providers, professional organizations, that all advocate with and on behalf of people with intellectual and developmental disabilities and their family, and that represents the culture and linguistic diversity of California. We're a fairly new collaborative, as Judy mentioned, but we have California Supported Living Network, Disability Rights California, Easter Seals Southern California, CDCAN, APSI, Association for People Supporting Employment, State Council on Developmental Disabilities, and the California Respite Association are some of our current members. We've been actively working to recruit self-advocates, families, Disability Voices United, Integrated Community Collaborative, we were happy to have at today's meeting. We actually met this morning. And we're hoping that they will be considering joining as a member for the Path Forward Collaborative. It's really been such a pleasure for me to be a part of such a group of such forward thinkers. And if any folks are interested in becoming a member of the Path Forward Collaborative, please feel free to contact me. I'll be sure to send you a Google link for the membership application. So Judy asked me to respond to the May revise. And first, I have to start by recognizing the crisis that we're in. Unprecedented and currently with no end in sight. The world has certainly changed, and we all hope for better outcomes on the other side of all this. In previous years, reductions to the California state budget that have impacted the Department of Developmental Services budget were a result of a budget crisis. So it was about money. Right now, we find ourselves in yet another budget crisis, but this time what makes it different is that this budget crisis is not only, it's still about money, but it's also about a worldwide public health crisis that we're dealing with. So while we appreciate the efforts made to lessen the cuts to the developmental disability service system in the May revise, we all must think a little differently right now. Certainly lives have been upended for so many people. Our routines have been disrupted. Everyone's quality of life has been compromised. For many people who are at the greatest risk because they are medically fragile, elderly, or perhaps they experience complex behavioral needs that make physical distancing and wearing a mask difficult, if not impossible. There are people in the community, these are the people in the community who will find themselves isolated, staying at home, sheltering in place in this public health crisis for the longest, unable to return to the regular day activities that they once enjoyed before. It's simply too dangerous for them to do so. For many people, the outcomes of contracting the coronavirus would be critical to fatal. We must focus all of our community efforts on the 3 S's, safety, security, and stability. So safety, preventative personal protective equipment. I'm not sure I need to say too much about this. We are all struggling to scramble to find our own face masks and gloves and cleaning supplies and yes, even toilet paper. For employers of essential frontline workers providing that person-to-person service, securing those personal protective equipment for their workforce is a mandatory requirement. Direct support professionals must have the proper personal protective equipment that is required to do their job in a pandemic. Their biggest fear is that they will be the one to bring the coronavirus into the home and transmit the virus to the people that they are privileged to protect and serve. People continue, so please, everyone, continue all your advocacy efforts around ensuring that our community has the preventative personal protective equipment that we need for our job. I know State Council has authored a letter, and we certainly circulated that and appreciate that. So security. Our system needs to pivot to fund services and supports people choose, control, and can actually use. Any cuts to funding for services that are currently being delivered person to person for health and safety reasons must be strongly opposed. People that rely on essential life-saving services should not see that funding cut right now. They have relied on their direct support professionals to successfully support them up to this point in a public health crisis. It's undeniable that this would send the wrong message to the critical infrastructure of frontline direct support professionals who have defied shelter-in-place orders, faced their own fears, left their homes, rose above and beyond to meet the moment in a worldwide pandemic for Californians' most vulnerable populations. Imagine the optics of cutting other essential workers' wages like emergency room nurses, police, fire, EMTs. Let's face it, the low rates that the state pays to providers for developmental disability services, the majority of those rates go directly to direct support professionals' wages, to their paychecks. So if we look at cutting those services, I just can't imagine telling a direct support professional right now who's been showing up every day in a pandemic that they're about to get a pay cut. With no end in sight to the pandemic, service providers who are providing essential person-to-person services will continue to need to be at the ready to respond to additional crises, wildfire evacuations, power outage disruptions, and hopefully not another dam break. But these are all things that we can surely expect in the upcoming months. These are the services that must be present, react, respond, and act immediately, potentially managing multiple crises all at the same time. While everyone else seeks safety, they're out there on the front line. We've got to come together to find efficiencies elsewhere within the system. Additionally, we must monitor, address, and respond to any equity and disparity issues. This public health crisis has certainly impacted everyone differently. As mentioned earlier, remember that any cuts to in-home support services, increased costs to the DDS budget for SLS, and definitely impacts families. The uniform holiday schedule, again, that nobody really understands, also falls on SLS and families to cover. So stability. Can we preserve the current infrastructure of the entire system right now? You know, that's the question before us. What are we paying for versus what services are actually being delivered and that people can use? Even in a public health crisis, any efforts to rethink, retool, and reimagine service delivery must be individualized, integrated, and in line with federal home and community-based services final rule. Department of Developmental Services, the state of California, and our entire community have done so much work and dedicated extensive resources to preparing for this for so long to move the system here in California towards HCBS compliance, home and community-based service compliance. What's that? Integrated settings and individualized services. We have so much talent and expertise, and we got to generate some enthusiasm to reimagine the infrastructure of the developmental disabilities services. We all need to work together to evolve. Now's the time to advance the federal health, home and community-based service efforts here in California together. We will have missed an opportunity if we focus our efforts on how we continue, preserve, and maintain segregated congregate settings and replace them with segregated congregate settings. So we really want to see that work together and reimagine that a little bit differently. Maximizing the federal reimbursement dollars. In a budget crisis, we can't leave any money on the table that can support the services that people need due to health and safety. We shouldn't even do that in good times. So thank you, Allison, for such a great presentation. Let's keep taking action on this issue. Increase the oversight and the accountability until California can fully realize the maximum reimbursement funding that we have available to us. We must keep those programs whole that bring in the most federal reimbursement dollars to California. These significant cuts to our system, as mentioned, won't be triggered without additional federal fundings. We all have to respond to the call to action to tell Congress to pass legislation that will adequately and responsibly enable states to respond to this public health crisis and avoid cuts to our system. So make those calls, write those letters, tweet and retweet all those advocacy messaging that supports these advocacy efforts. We will need to get loud to have our voices heard. So how do we focus services that can provide whole life supports? Blended and braided funding of service delivery. We already have the tools to support people to create lives that they want. SLS, ILS, respite, and self-determination do this every single day. People in the community connect and make friends in the community just like we do. So expand access to these services and maximize the generic resources that folks have available to them. For folks living independently or at home with families, there could be independent living services, tailored day services, and IHSS blended and braided together, or supported living services, tailored day services, and IHSS. For younger folks or even older folks that live with family, blending respite care services with independent living services and personal assistance and tailored day services and IHSS. How do we build these things around a person and support their whole life? It may be possible. It may possibly be the best kept secret that independent living services can be provided to people living at home with their families. So if that's a service that folks need, they should reach out to their case manager. And self-determination, DDS has issued a directive. And it's a coronavirus directive for participant-directed services. So it's a huge opportunity. And then we have to think about where we can work on employment services and paid internships to be included in this whole life wraparound supports. I think there's huge opportunities for so many people. Are there other ways to provide wraparound services, whole life services? Let's get creative together. And lastly, we need to be ready to support folks with their mental health needs. We are all experiencing various levels of loneliness and isolation and PTSD from this whole event. So, you know, the pandemic has definitely impacted everyone differently, and our community needs to be ready to support people when and where they need the supports the most. So thank you again for the opportunity to speak to you all today. Together, we're all going to get through this and do better because of this is what our hopes are. So thank you, Judy.
Thank you so much, Mark. Mark, a bunch of people want to join the Path Forward Collaborative. So if you wouldn't mind,
email in the
put
chat.
your email in the chat, put your email in the Q&A on how people can get in touch with you to do that.
Thank you so much.
All right, thanks, Mark. Our final speaker, but then we have a ton of questions that we will get to answer, is Nikita Wang. Nikita is a self-advocate leader in our community who always makes me think about things I haven't thought about before. And I so appreciate you coming on and talking a little bit about how some of these cuts might impact you. So Nikita, you need to unmute your computer and go ahead. Thank you, Nikita.
My name is Nikita Wang and I'm using a communication device. I'm a client of ALARC. I'm a recipient of in-home supported services. I am also a student of East LA Community College. I am majoring in psychology. After completing my AA degree, I plan to transfer to a 4-year college to continue my studies in psychology. I want to work as a bilingual mental health counselor. My brother and I both have the diagnosis of cerebral palsy. The result of our medical condition, we need 24-hour one-on-one support in order to get out of bed, repositioning, pressure relief, clearing air passage, get dressed, eat, bath, and to use the toilet. After many years of advocacy, self-determination for all, we are extremely grateful and fortunate to have been selected. The cuts in in-home supported services, regional center, and college will be a triple whammy impact on my brothers and my quality of life. Since I was 14, I have been living with anxiety and depression. I understand how it feels like to be in a total darkness and hopelessness. At times, I wanted to give up. My mom advocated for me to get counseling. My counselors helped me find my strengths and power. Mental health professionals are very much needed in our community, especially for those with developmental disabilities in underserved communities. Too many times, we are given medication instead of counseling, isolation instead of inclusion. This approach makes things worse for us. I have been outreaching to self-advocates and their parents so that we may support each other and find treatment early. I am serving as the president of Self Advocates Board of Los Angeles County. At the Glendale office, I mentor with other self-advocates along with a team of professionals at the State Council on Community Inclusion in Transportation, Jobs, and Housing. Like many other students with developmental disabilities, I spent many years of my high school in special education classrooms. When I began college, I realized that if given the right support and accommodations, I can succeed in general education. At East Los Angeles Community College, I met teachers and staff who believe in my abilities. I also met many other students who had similar struggles as I do, so we understand how we all got here. I rarely miss a day of school. My support people help me get ready in the morning. We take public transportation to school. After class, I go to my professor's office hours if I have questions, or I go to the Learning Center for tutoring or to use the computers in the DSP's Learning Lab. Currently, I have a 3.7 GPA. In January, I applied for a part-time job on campus. If the school budget were to be student services and part-time jobs can reduce. I have a group of dedicated team members supporting me. I enjoy my independence, going to school, volunteering, and social activities. If my services were to reduce, I will have to depend on my mom's help. I do not want to be a burden to her. Besides, if she helps me, she won't be able to help my brother. She would have to choose between us. That would be tough for her since she wants to help both of us.
Thank you, Nikita. That was really great. I'm so proud. And there's comments in the chat of people saying thank you for speaking up for us, other self-advocates who are part of our audience today. Thank you, Nikita. So I'm going to get to some of the 36 questions that are still in our queue. Anybody can answer them at any time. A whole bunch of them are for you, Allison. Want to make sure you're still there. People don't understand that concept of institutional deeming, which is like one of my least favorite terms in the DD system. Would you mind explaining what that means?
Sure. And sorry, it's incredibly hot in here, so I'm like trying to keep myself. Okay, institutional deeming. So, you know, it has a little bit of a flavor of a bygone era, the term. The term comes from the idea that back, you know, decades ago, as many of you probably know, most people with IDD lived in institutions. They lived in institutional settings. And here we call them developmental centers. They go by different names in different states, but they're exactly the thing that we have worked hard and, you know, to eliminate in the state of California and nationwide. But back in the day, decades ago, you know, you had to sort of from a federal funding standpoint to access community-based services, home and community-based services, without having to pay a substantial cost of them. You had to prove to the federal government that you were basically had enough support needs that you would qualify to be in an institution, if that makes sense. So, and if you are at that level, if you go through institutional deeming, what that means is you can access federal money without usually, if you're a minor, it varies a little bit between minors and adults, but focusing on minors, because that's most of the people affected, without having to pay a portion of those costs. Okay, so it's sort of this archaic term, you know, and so, but the important thing is if you agree to institutional deeming, the only thing it doesn't do anything else other than enabling you to access these services in such a way that, first of all, you don't have to pay. If you're a parent, then it means that you do not have to pay a portion of those services, and that the state can get money from the federal government for those services. So, you know, I sign the paperwork every year for institutional deeming and I don't think twice about it. You know, it's a word, I really don't care. But I understand that some parents, you know, might feel that that term, you know, is problematic, but I would suggest doesn't really mean anything. That's really all it means. It's a piece of paperwork.
Thank you. Here's another question that Aaron and you can answer, or I can answer as well. So the budget does talk about this, state budget. It does say, have a requirement, how this is going to play out, but it does have a requirement that eligible consumers are required to be on the waiver or on the state plan amendment. How that's going to play out is not yet been released, although it will be released probably next week, the details. So DDS hasn't given us the details yet. What we think is going to happen, and please Aaron and Allison fill in, but this is what DDS has told us, is that an individual, a child, so therefore either family members or an adult who is eligible to either be on what's called the waiver, and what a waiver means is the contract we have with the federal government, which allows us to get money from the federal government for services here in California. That if you are eligible to be on that or on any kind of program that gets us federal funding, and you refuse to do that, you will have a significant financial penalty. And they're not going to call it a penalty. They're going to call it a cost sharing. And you'll see that there's an additional $2 to $4 million in the budget that they believe will come in because of this cost sharing that families and individuals will have to pay. What that could potentially look like could be very significant for some people. It could be the entire amount of federal dollars that we could have been receiving for that individual services. So it could be, for somebody who's getting a substantial amount of services, it could be in the thousands and thousands of dollars. This is not this effort by DDS doesn't exist in order to penalize people. It is more of a stick to get people on to one of these federal programs to ensure that we're drawing down some of that money. So I don't know if Allison or Aaron, if you want to comment on that explanation.
I just like to add a little more nuance that I probably should have said before. The important thing about the institutional deeming, that prior question, is that for some people that are not eligible for Medi-Cal in any other way, like maybe they make too much money, that's usually the reason why they're not eligible for Medi-Cal. Institutional deeming is what enables you to get on Medi-Cal anyhow. Because if somebody is institutionally deemed, two things can happen. One is that they can get on Medi-Cal, and then once they're on Medi-Cal, they can then get their regional center services reimbursed by the federal government. So if you're already on Medi-Cal, institutional deeming isn't really important for you because you're already getting your waiver services paid for. And so this is really for higher income families who maybe already have private insurance, right? If you already have private insurance, you may not feel you really need Medi-Cal because you're already covered. And so there maybe isn't that strong of an incentive to sign up for Medi-Cal. Now, there are other advantages of Medi-Cal, even to families, like you can't get IHSS unless you have Medi-Cal, for example, and that's a really attractive benefit. And there's other important benefits as well. But for some people with private insurance, it may feel like, it's kind of a bit of there's a time cost, it's a bit of a hassle. So that's why that's there. It's to encourage people who are not already on Medi-Cal because they don't qualify in any other way to get on Medi-Cal through institutional deeming, which means that the state can start to draw down that 50 cents on every dollar, which are not drawing down for a fair number of people right now.
Aaron, did you want to add anything with that?
I think what's interesting is that
before you answer, Aaron, let me add an additional question that I'd like you to address, is that a lot of people are saying in the Q&A that their regional centers are saying you have to do all the work yourself, or the regional centers are saying you're not, this is up to you, or they don't even know what people are talking about when they bring this up. So address all that, please.
Yeah, I think what's interesting is the governor's budget does anticipate additional Medi-Cal revenue for regional center clients in the order of 27 million. Now, 27 million is not the 800 million that Allison talked about. So what they're expecting is that people's income levels will drop down low enough that they'd become eligible in the traditional sense. So I'm excited to keep listening in Sacramento to hear how people are talking about what Allison's pushing. It's being heard, people are paying attention. So that's good. So I'd be interested to see how that plays out and if they really can get that additional dollars. But what you pointed out, Judy, is who has the motivation for getting it done? You know, is it the individual family? It's my services are kind of be the same, like if I get this or not. So it's more the system has the motivation to get it done. So in my mind, the system has the motivation, so the system should be getting the paperwork done.
Yeah. I want to add the Lanterman Act. I mean, the Lanterman Act makes very clear, Lanterman Act is what created the regional center system, basically, and says that part of the job of regional centers is to help people access generic resources that several people have mentioned. And part of that is helping people access Medi-Cal. So in theory, that is the job of, it's not the job, I don't want to overstate that, it's run by counties. But to the extent that people are struggling, you know, to finish the paperwork to get on Medi-Cal, regional centers should be helping people find assistance. Now, is that happening? No. It is happening hardly ever, at least in my experience as a parent. And I think that's something we need to change. I think that is exactly why it's in some ways a good thing that in the midst of this context, we're really surfacing this issue. And I think we need to systemically find better answers and get people the support that they need, because it's not fair to penalize people with a stick without giving them appropriate assistance. So I'm really not at all surprised, but I think it's important in all of these comments that that's not happening now.
So many more questions on this. And I don't want to spend all of our time on this, but a lot of people are interested, because if we can really fully fund this, we will be able to eliminate some of the cuts.
If I can inject, like it is the regional center's job, but I would imagine if the state gets convinced there's potentially $800 million additional dollars that could come in, that's a really good argument for the state to invest in additional service coordinators to fill out the paperwork.
I don't want to hang too much on that number, by the way. It's a little oversimplified. If you read the report, you'll see why. Because actually the state is not producing all the numbers that would help us get a more precise estimate, but we don't have numbers to say it's wrong either. The truth is, we don't know the real number, but I think it's probably real money, just to,
Right.
Yeah.
Can you clarify whether there are federal regional center caseload requirements that undercut the ability to maximize the waiver program?
We're already out of compliance with those requirements.
And we're still getting the waiver money. Okay.
And we're still, you know, I mean, in theory, could the federal government cut us off? Well, you know, there's actually precedent for that some years ago, but I think it's very unlikely. It's been for years now, we've been out of compliance with those ratios, which is not a good thing, but I don't think that's really in and of itself a reason not to do it.
Got it. Will people who do not qualify for federal funding due to not having do people need to have two qualifying deficits? So that's one of the things. So there's people who do not have two qualifying deficits and they're not included in the cost sharing metric, or will they be absolved? So this is related to that kind of stick.
Yeah. So this is, I think what they're getting at, the requirements for institutional deeming under federal law are not exactly the same as the requirements for receiving services under the Lanterman Act, right? They're slightly differently worded. I would argue it's a very rare case in which you would qualify for services under the Lanterman Act for regional center services, but not meet the level for institutional deeming under federal law. Is it impossible? It may not be impossible, but I think it's extremely rare. So in those cases, if let's just assume that would happen, it would clearly be unfair to penalize somebody for not being able to get on the waiver if they literally didn't qualify. But I personally, I think it's a really small number. And the reason is, if you look at the way they're worded, you know, it's actually on paper a higher bar under the Lanterman Act than it is under institutional deeming under federal law, because everybody in the system now would have been in a developmental center, you know, 20 years ago, and that's essentially the standard. So I don't think that's a big barrier. Never say never, but I don't think it's a significant obstacle.
Great. Thank you. We still have a ton of questions, so we're going to run a little bit long just because I don't know that we'll get to all of them, but I do want to get to some of them. Somebody asked, I thought I read in the new budget that a program that supports people with disabilities who also have mental health needs is being cut. Do you know anything about this? Duly diagnosed? I don't recall it. Aaron, I'm throwing it to you.
I'm looking, you can't see, but I've got my my quick notes in front of me, but I'm also remembering that too. Hold on a moment.
If it's a new proposed program, it's probably off the table.
Yeah, that's true. Anything that was new in the budget is gone.
Yeah.
Anything.
I'm remembering that too. I'm not finding it in this moment, but I can find it and get it back to you.
Okay, thank you. Here's a general question. How do we encourage service coordinators to do their jobs? Now, that's not all fair. Oh, you found it, Aaron?
I did.
Okay,
So the Department of Developmental Services had proposed a new program, or the governor did in January, that would be trained support services for individuals with co-occurring developmental disabilities and mental health services. That program would be new. It would have cost $2.6 million, and the governor's withdrawn that proposal. So this is one of those really good ideas that we had for new programs when we had money that is pulled back. And even if we get the federal dollars, wouldn't necessarily be back on the table.
thank you. And I'm going back to the beginning of some of these questions. To clarify, I'm pretty sure that Catherine Blakemore said it at the beginning, that dental benefits for adults on Medi-Cal are going to be eliminated, or are they reduced? I believe that it is. I remember hearing that in the briefing of Dr. Galley. Does anybody confirm that with me?
Impacted, but I don't remember to the extent.
Okay. I know that it is in the summary. I don't have the specifics, but I know it is in the summary of that has been prepared by this IHSS. There's just a whole lot of questions about how we get organized around advocating to Congress about more federal funding. You know, how do we get lists of who to target? What are the messages? How do we get this stuff to, you know, outside of our state, to our family members? You know, maybe that's something that we could talk about, Aaron. Maybe something that the national organizations are really getting involved in, to really get these materials out to people, to make these phone calls. What we will commit at DVU, and maybe Aaron can as well for the state council, is, you know, the information, we will collect as much information as we can to encourage people to write emails. Don't write snail mail. It's going to be too late. And by the way, it never gets there anymore because nobody's working in the Capitol. But we can get you some lists of some emails and some phone numbers for targets, and with a script.
Yeah, what's really great about the link that we sent out is we gave you the one central phone number for Congress. So you call that anywhere in the country, and they'll ask you where you're from, and they'll route you to your right representative. So that's really easy to use.
And the bill that's being considered in the House of Representatives is called the HEROES Act, I believe. Is that correct?
Yes.
Okay, that answers that question.
So Judy, I'm reading for the budget regarding Department of Healthcare Services and the reduction in adult dental and other optional benefits. So the governor proposed to reduce adult dental benefits to the partial restoration levels of 2014. Okay. So it's a reduction to the 2014 levels.
Okay.
And Judy, as far as advocacy, Judy, I would just add, Twitter is a powerful tool. We've used it, the CSLN has used it in previous advocacy efforts. We called it the Twitter revolution. We had quite a following. We had some folks, even legislators, direct messaging us about what to do next, you know, or who to tweet next. So it was pretty effective. There is a website called Tweet Congress that I just found. So also another resource to get people's Twitter handles, and really send photos, tell your story, like Aaron said, in a brief tweet, pictures, those kinds of things go a long way. So I think social media is also, in addition to letters and phone calls, another avenue for advocacy.
Great, thank you. Okay, we're back to the waiver. A lot of questions about the waiver and about getting people in federal funding. People are asking, getting service coordinators who are discouraging people from enrolling. This has been going on for years. Some people have been talking about this for many, many years, and there seems to be a disconnect between service coordinators and people, and the people who need some hand-holding to get on to the waiver. there's also questions about, what are going to be the targeted outreach efforts? It seems that if this budget goes through, there will be a requirement for people to be on it. So with this requirement and this potential sticks for people who aren't on it, there needs to be an outreach effort and programs that maybe use different terms than institutional deeming so that it doesn't freak people out, that there needs to be outreach to counties who put up huge barriers to people. Who are the agencies that may be best positioned to provide that outreach and to create some of these materials to educate people on the importance of being part of Medi-Cal and being part of the waiver? So I don't know if anybody has any ideas.
These are the really important questions. I think it's gonna take a, I mean, I have my own thoughts. I mean, other people probably do as well. I mean, my opinion is it needs to be a process that is ideally guided by an independent entity, but relies on really rich stakeholder input and feedback, because we need to know really what the barriers are. I mean, I think even here it's helpful because at least a lot of the comments suggest that a lot of the problems are, the lack of hand-holding, assistance, support, whatever you want to call it, on the part of service coordinators. And I think it's going to take a really multifaceted community effort to figure out how to address that challenge. It's not a simple challenge, and it may vary geographically in different parts of the state, it may vary across regional centers. So I personally think that process should be guided by an independent entity that is skilled and experienced in tackling these kinds of problems, as opposed to being handled like within a particular department. That's my own, and that's, just full disclosure, that's my opinion, that would incorporate different regional centers, as among the really important stakeholders and service coordinators, but not having any one entity actually running the process. I think that sort of independence, would be important. That's my opinion. I don't know how it will unfold.
Yeah, I mean, I agree with you completely. I also want to say that if a miracle happens and we get more federal funding so that a lot of these cuts don't go into effect, there is still a need to maximize the federal funding. We have been calling for this for years. This is just an example of how we can prevent future cuts. Remember, this is just the budget for this year with a little bit of trickle into future years. We don't know how soon the economy is going to rebound. So we are looking at potentially years of cuts.
Well, I think this proposal, the Department of Finance projects the deficit that we're in is multiple years. It's big, it's multiple years, and it's going to take multiple years to get through it. But I think the proposal, I could be wrong, but takes that into account. And the question is, if this pandemic keeps going and it gets worse, and if we as a society continue to devolve the way we're devolving, then kind of all bets are off. But I think they try to incorporate some level of that in going forward.
Right. All right. I'm going to stop there because I think that a lot of the questions, we still have 41 questions in the queue, but a lot of them are similar, and we will try to get more information out there between the Path Forward Collaborative, which we're all part of, and we have signed up, we are in, and the State Council, which gets information out regularly, and Disability Voices United. So we want to thank everybody. We had several hundred people stay with us until the very end of this webinar, so we really, really appreciate all of you. And we will be having another webinar next week, because we're always having webinars. Next week, we're going to be releasing a survey of how families and individuals are doing. We're also the State Council will also be releasing a survey that they took as well of their local regional members, and to talk about how people are actually doing during this coronavirus pandemic. So we look forward to everybody joining us in the future, and thank you so much for being with us today. And we will have, let me just remind everybody, we will have the information up on our website of this recording by tonight or tomorrow. And we will also at disabilityvoicesunited.org/CV for coronavirus. We will also have the transcript within a week, and within a day or two, we will have the Spanish interpretation that some of you didn't realize that you could get Spanish translation. That will also be up on our website in a recording by hopefully tomorrow. So thank you all again, and we look forward to seeing you next week. Take care. Bye-bye.